Understanding how your bones work and what gives them structure and support is a very important topic in physiology and biology. And what I'm going to do in this video is discuss the basic anatomy of bone structures and how everything hopefully works. And so to begin with, if you were to take a bone from a cadaver, for instance, and cut a cross-section of it, what we would get if you looked at a slide under the microscope, a thin enough slide, would be something that looks like the picture here. And to kind of blow things up and make things easier to see, we have this blown up image to the right that's a little bit easier to read. And what we're going to make a note of is the first thing that we're seeing is how there's a lot of these kind of large circular shapes, and these things are called osteons. So this whole circle is called an osteon. And the osteon is the fundamental unit of bone. And an osteon is comprised of a bunch of other things. And arguably one of the most notable of which is something called the Haversian Canal. And the Haversian Canal is this structure at the center of it, of the osteon. And its job is to allow a space for veins and arteries to supply nutrients. And what are these veins and nutrients going to be supplying energy and oxygen to? The answer is things called osteocytes. And so you can kind of make out these osteocytes in the slide, but here they are, these little purple pink things. And so you've got about 20 osteocytes per osteon, and the osteocyte's job is to secrete things that will make up something referred to as the extracellular matrix of the bone. And the extracellular matrix is kind of everything outside of each osteon, and it occupies this blank space here. And the extracellular matrix is a place where ions can be deposited. And so if I can finish spelling this. So what's going to happen is the osteocytes are going to be depositing ions such as magnesium and calcium and maybe some phosphate ions into the extracellular matrix. And within the extracellular matrix, they're going to form these kind of mineral structures that are going to provide you a lot of strength and support and make your bones very strong. But that does come at the cost of making it slightly brittle. And so our intuition tells us that with bones, they are very hard. And so how are you going to be able to supply a bunch of osteocytes nutrients? And so it's very difficult to make out from the slide that we have, but blown up in this image to the right, we can see things called canaliculi. And in Latin, it pretty much means just little canals. They are microscopic canals that are what will provide space for the osteocytes to have access to the Haversian Canal. And within the canaliculi, you're going to have things like venules and arterioles. And these things are going to be within your canaliculi. They are essentially just smaller versions of veins and canals, essentially. And then we get down to the individual capillary levels where we have single file red blood cells passing through them. And so being able to provide adequate nutrients to your osteocytes is what's going to allow them to secrete things into the extracellular matrix that will give you very strong bones. And another important note to make about your extracellular matrix is that it's composed of a protein called collagen. And then collagen is a quaternary protein. It's composed of 3 very large polypeptide chains that has proline, hydroxyproline, and glycine. And the reason that we need the glycine is, if we were to look at a higher level perspective of what collagen is, it's essentially 3 intertwined polypeptide chains, and every time they intersect each other, you need to have a glycine present because of its very small R group. Its R group is just a proton, which is the smallest R group you can have on an amino acid. And then a final note to make about collagen that's existing within the extracellular matrix of your bone is the fact that your hydroxyproline is going to come from proline, and you need vitamin C to make hydroxyproline from proline. And so if you don't have vitamin C, you can't make hydroxyproline, you won't have good collagen, you're not going to have good connective tissues, not just in your bones, but in other places. And that's the reason why we see things like scurvy if you don't have vitamin C. So a take-home message from this is make sure that you eat oranges and other good sources of vitamin C in your diet if you want to have a good, strong bone structure. And so this is going to wrap things up for this video. I hope you guys find it useful. Let me know if you have any questions, and thanks for watching.